From what I understand, it's like $50,000 for an HIV positive individual a year for their medications.
A lot of young people nowadays think, oh well, I can just take a pill and that'll be that. There are side effects. The most common ones are nausea, vomiting, diarrhea.
And then when the cocktail came out in '96, then that's when I was experimenting with the different regimens and stuff like that, and found out that I was allergic to a lot of the medications, and that's when I started having a lot of problems.
And the drugs that they had prior to '96 really made me ill, so I stopped them. And whether that's a good thing or bad thing, I felt it was a good thing at the time because of the drugs that were offered back then, because it was making me more sick. But now today I understand being on a regimen it's good for you and it will prolong your life, so that now we call HIV and AIDS more of a chronic disease than a death sentence.
I do have friends that can't leave the house due to diarrhea because they might have an accident.
The side effects of some of the medications, you never know what's going to happen. You may be eating dinner, and after dinner you get a little rumble in your stomach, and you better be prepared for what may happen.
In the beginning, I took 33 pills a day, 11 pills 3 times a day, and sometimes I'd forget. And by not taking my medication at times, if you don't take it correctly and consistently, there's the possibility that you become resistant to the medication. It's such a smart disease that it figures out how the medication works, and then the medications are no good.
Throughout the time, I would have reaction after reaction with the drugs. I became resistant to a lot of the drugs. I remember having a rash for over a year. I was bright red. I looked like a lobster, just from one of the medications that I was on.
You have to forgive me, but I call it AIDS brain. That's one of the side effects, I think, from the medications and from the condition. I just forget. I could be talking to somebody and in mid-sentence forget what I'm talking about. It's very frustrating, and it makes me feel stupid.
And so I take my drugs on a regular basis, and I'm here today in 2011. Who would have known? 96 I was in the hospital and everyone came in to say goodbye, and I'm not really supposed to be here. I was given a second chance, and so I appreciate it, and I'm going to do whatever I can to make a difference.